hospitals across the country are being pushed to the limit as the U.S. records more children with COVID than ever before. More than 252,000 pediatric COVID cases were reported last week alone, the highest weekly total yet. On average, about 365 children are being admitted to the hospital for the virus every day. Now more states are calling on military personnel for help, including in Idaho, where authorities have officially declared a crisis. Our Kaylee Hartung is there with more.
This morning, as millions of children start the school year, the U.S. setting an alarming new record. More than 252,000 children diagnosed with COVID last week, the highest number of pediatric cases since the pandemic began.
We're calling this the fourth wave, but it has certainly been by far the most impactful surge, really hitting at children and adolescents.
In Texas, where the number of children hospitalized with COVID hit an all-time high over the weekend, 11-year-old Levi Quartucci tested positive a few days after going back to school, then spent 4 days in a hospital bed.
It just felt horrible throughout the whole time.
He's now recovering after fighting for his life.
I would say to take it seriously and to protect yourselves from what can be a really, really dangerous and awful disease.
Hospitals across the country are now calling for help, and the Department of Defense is answering, sending military medics to support Alabama, Arkansas, and Idaho.
This is a war against COVID. It is not over. We are very much in the middle of the battle.
Idaho's governor calls it an unprecedented point in the state's history. The health department now activating crisis standards of care for at least 10 hospitals, warning residents they could face long wait times.
When we get short on certain supplies, oxygen or ventilator equipment or what have you, that may require us to make some tough decisions about who gets what when.
Doctors say this time around the surge feels and looks different.
We don't have to have these patients in our ICUs. Every single patient that I've seen in the intensive care unit has been unvaccinated, and they're also younger.
That was the case for 31-year-old TikToker Alexandra Blankenbiller in Florida. She wanted to do more research before getting the vaccine.
I don't have a lot of energy for talking, so I'm going to try to make this quick.
But she was too late. Blankenbiller losing her battle to the virus just days later. In this final video posted on her TikTok, the influencer encouraging her followers to get the shot.
Don't wait. Go get it. Because hopefully, if you get it, then you won't end up in the hospital like me.
Diane, in Idaho, they have one of the lowest vaccination rates in the entire country. And as you heard one doctor here say, they're in the middle of this war against COVID, and they believe it could have been preventable at this point if more people here had gotten vaccinated. But if you zoom out, bigger picture, there is some good news. Nationwide, about 75% of adults have received at least one dose of the vaccine. Diane.
All right, Kaylee Hartung in Boise, Idaho. Kaylee, thank you. And I'd like to bring in Dr. Sharif El-Nahal, President and CEO at University Hospital in Newark, New Jersey, for more on this. Dr. El-Nahal, thanks so much for being here. How worried are you about this rise in pediatric cases, and what are you seeing at your hospital?
Thank you so much for having me on. So first of all, I'm extremely worried about it. I think as we begin school and as people begin work again in the return to work process, we're concerned that kids may get it in school and then spread it to vulnerable folks at home. In addition, we're seeing a surge in pediatric cases across the country that hasn't hit New Jersey yet, but we're all very concerned about it because, frankly, a good number of kids are not even eligible for the vaccine yet, in particular that critical age group of age 5 to 11. And vaccination rates for older kids aged 12 to 17 are much too low to be confident that returning to school will not be accompanied with outbreaks and increased cases. And so we've already met with our peer hospitals, our peer clinics, our Greater Newark Healthcare Coalition, which brings together the healthcare system, is planning for, what we will do when we get more pediatric cases, and we're expecting it. We've had more pediatric visits to the emergency room for COVID-19 than we've seen since the beginning of the pandemic, including when my hospital was filled to the brim last April. And we're concerned that this trend will only get worse in the Northeast.
Now, is this because the new variant, the Delta variant, is affecting kids more, or it's just because it's more contagious, and so just by that nature, more kids are being infected?
It's definitely both. So the fact that the virus can spread as easily as chickenpox is a major problem and the most important problem, because it just simply means that more people will be getting it, more people will be susceptible to it. And so that's one factor. But a couple of different series and studies have shown that the risk of hospitalization when you get COVID-19 is about twice the original variant of the virus that really plagued the Northeast and much of the country last year. And so I think you're seeing increased spread, but also increased severity of the Delta variant in recent studies. The other thing I'll mention is we're seeing more breakthrough hospitalizations. The New Jersey Hospitalization Association yesterday, and I'm on the board of the organization, released a report saying that 75% of people hospitalized are unvaccinated, which still shows you that being unvaccinated is the greatest risk. But concerningly, that means 25% have had at least one dose. And so I think the issue of waning immunity is something we need to look at. And boosters, I think, for most people in our society can't come soon enough.
Now, hospital systems in a number of states are being pushed to the limit. Some are even calling in military personnel to help now. So where does this go from here?
Yeah, I think it's concerning that we're back to a point where the military needs to deploy again. My hospital had incredible heroes from the U.S. Army Reserves who came and literally saved us when my nursing staff was down by a third, when so many other critical clinical and non-clinical staff who keep this hospital going had to be out, either because they were sick with COVID themselves or they had a loved one who was ill or childcare issues. And these things are resurfacing again. So the fact that DOD has to step in to supplement clinical staff is just a sign of where we are. The fact that we are surging to a point that is approaching what we had last winter overall, and certainly at a local level in some places, what New York and New Jersey experienced, that was right there in the center of that last year, is really concerning. And so I think we really need to think about a public health service corps, in addition to what we have now, that can be deployed specifically for public health emergencies like this and not have to rely on the heroes that normally have to be deployed abroad to defend us and defend our interests.
So how concerned are you now about this new Mu variant we're hearing about?
You know, the Mu variant is concerning from the standpoint of potentially being resistant to immunity that we get from the vaccines. There's some evidence that that may be the case with some very concerning mutations. But the promising news is that it does not, at least yet, seem to be predominating in the areas where it is spreading. And so I think that is the most important variable, as I mentioned before, how transmissible the virus is, because it just simply means that more people will get it. And so far, it still seems that Delta is winning out over Mu, which is good news because the vaccines do protect you, especially against hospitalization and death against the Delta variant. So good news in this, from the sense that a more susceptible virus is the one still predominating.
All right, Dr. Sharif El-Nahal, always great to have you. We appreciate your time today. Thank you.
My pleasure.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.